82s, congratulations on this milestone. My advice to you, cliche as it is just get better each day. Master your craft, one prep at a time. Just get a little better. Some of this will be extremely difficult, some of this will become extremely easy to you. Regardless, just get better each and every day, prep by prep. Don't get worried about one prep. Just keep practicing. When it gets difficult, lean on your incredible faculty, and eventually it just becomes a little easier. So congratulations again and good luck. 82 is actually my biggest point of advice for being real. Learn Dr. Radnicki's name, how to spell it, and find him at the Jays game because he will buy you a beer. Peace.
Hey, how's it going? My name's Scott. I graduated 2019. My advice for this year would be, as you guys have probably been doing, be flexible, but also be open to trying new things. Everybody has their own styles, so don't be afraid to try something new and see what you like.
Hey Operative Lab, I'm Nikki and I graduated in 2017. I just want to encourage you guys to learn as much as you possibly can in Operative Lab this year. You are going to use so much of what you learn in this lab every day at work. Take the criticism, help it make you better, practice extra, and get to know your professors. They are your best resource, and before you know it, they're going to be your colleagues, and you may even be friends with them someday. Also, make sure Dr. Radnicki teaches you guys about the time crappiness continuum. I think about it every day. It's the best way to know when to stop working.
Hey sophomores, congratulations on finishing your first year of dental school. Some of the best advice I could give you is to be patient with yourselves. Dentistry isn't easy and you're not going to pick up everything on the first try. But be patient, work hard, and sooner or later the skills will come. Another thing would be to not always take your preps and your projects to the easy graders. Get feedback from every instructor. They're all full of knowledge and they all have different tips and tricks on doing things, and it's going to be really helpful in the future. Lastly, enjoy your time. If you don't realize it yet, you will when you graduate. That you're very lucky to attend Creighton. And you're going to get some of the best clinical experience, and you have some of the best instructors there helping you succeed along the way. This year isn't going to be easy, but help each other out, work hard, and you'll get through it. Good luck.
My name is Maggie Larson. I was part of the graduating 2021 class. I just want to say welcome to D2 year. It can be a lot of fun. It can also be super challenging. So some advice I have for you is to be flexible. Try out all the materials, try out all the different matrix systems. Now is the time to make mistakes because plastic teeth are a lot easier to fix than real teeth. So try everything out. But most importantly, I want to tell you to enjoy the process. Dental school can be super tough, but dentistry is also lifelong learning, so you might as well have fun while you're doing it. Good luck, everyone.
Alright, what's up guys? So I have a little list here I'm going to go through. Number 1, you will get a C or a D at some point in your operative lab career, so just deal with that. Number 2, follow directions. Number 3, cut on the right tooth. You have no idea how many people freak out during like a practical and cut on the wrong tooth. It's so dumb. They'll ask for a ML on number 8 and people will show up cutting number 9, so don't do that. 4, follow directions. Number 5, Dr. Rad probably will tell you to go redo something at some point, and most likely multiple times. Number 6, and lastly, when it comes to operative lab, follow directions. Number 7, in clinic, try to take control of your schedule as much as you can. Don't rely on a patient care coordinator to just put you in a stroller and push you to the finish line. Pay attention to your own requirements and just take some responsibility. Number 8 is super important. Have fun. Go to the bars. Go to CWS if that ever happens again. Go to Creighton games. Your classmates will become some of your closest friends, and they'll stay with you. And lastly, It's a little bit cliche, but just work hard and take advantage of what your instructors are saying to you, and come every day with a good attitude. There's a lot of people that claim they go to the best dental school, and I had a chance to meet a lot of people from a lot of different schools during residency interviews, and I can tell you that the clinical education that you get at Creighton is right at the top. So take advantage of it. Go Jays.
What's up, Blue Jays? Dr. Casey here. Graduated last year. Been doing GD here at PDS, a Pacific Dental Office in Tennessee, for about a year now. Wanted to share some tidbits with you, some successful advice, I would say, to help get you through the next 3 years. First and foremost, stay in school. By that I mean don't ditch out when you get done early at sophomore lab or in clinic. You know, if your patient doesn't show up, don't just bounce and, you know, start drinking beer or hitting the gym. Like, all that stuff's important, but you got the weekend for that. You got your evenings for that. While you're there, get what you paid for. I know you paid in a lot for this, and you want to get your money's worth. So by that I mean, you know, stay in lab, help your friends out, ask questions. Even though you finished the project doesn't mean there's nothing else to learn about the topic. So talk to different professors. Everybody's got a different point of view, different philosophies. And when it comes to clinic, if you finish early, get to acute care, get to oral surgery. Start, you know, applying yourself when you're not necessarily needed, and good things will happen. I've been, like I said, working for about a year now, and the thing I think I probably learned the most from acute care, because your ability to diagnose and triage and, you know, get people out of pain is, you know, that's where all this comes from. In the GD world, you can't rely on your new patients. You can't rely on your CCX, you know, your continuing care. You're gonna have patients in pain, and if you're able to fit people into your schedule that's already full and get them out of pain, that's how you have a big day of production. So just get used to that. Get used to working hard, and you know, finding the fruit where it's hanging. And yeah, I'd say that's about it. Just stick around. Don't bounce out. Don't call it quits early just because you're done, because you're never done. And you'll always get stuff thrown at you that's gonna make you learn more and keep you on your toes. So, you know, while you're paying for it, man, get as much out of the Creighton school as you can, because playtime's over once you're done, and you gotta hit the ground running. So you're already equipped to do so coming out of Creighton. You're gonna be miles ahead of everybody else, but you know, if you get the most out of it, you're going to be the better practitioner for it. So listen to what these guys say, and you'll be fine. See ya.
What's up, Creighton fam? Just a little advice from a recent graduate, 2020. Get to know your materials, your matrices and whatnot, your pins. Just so when Dr. Cavill tells you to place a couple pins and throw a copper band around a premolar, you don't look like an idiot. You can get her done.
Hey guys, a couple pieces of advice for operative. So the first one is, when you think you're done with your practical, you probably are. Quit touching it, you're only going to make it worse. And the second piece of advice is to try to get your speed up in lab, because when you get down to the clinic floor, you can't take an hour to prep a tooth. That patient's not going to sit there that long, and especially when you get to private practice. The faster the better, the more efficient you are the better, and there is no such thing as an ideal prep in the mouth. No cavity is exactly the same.
Sometimes dental school can seem a little bit frustrating, and it can be kind of hard and seem impossible. But if you just kind of take your time, have fun, and enjoy it, you'll learn a lot more that way. Just try to stay positive.
And my advice would be to work with as many different professors as possible, because they each have something different to teach you.
And if you sit next to a hot chick and you have to fart, use the high suction.
Hi, new D2s. Welcome to my favorite year of dental school. My name is Maddie. I graduated from Creighton Dental in May 2021, so new grad. I practice out here in a town just outside of Kansas City, Kansas, and it has been going great so far because I graduated from the best dental school out there. We are sending some advice your way for your D2 year. I would say, on top of everything that probably everyone else says, which is take your time in lab, go to all the different professors because everyone has something different and great to teach you. I really wish that when I was in lab, I would have really focused on the matrices. There's lots of different options, and they make or break your final restoration, and they make your life a whole lot easier if you can get good at them. So I think when you're in lab, that's the tedious, annoying part about lab, and you just want to breeze through the matrix part, but take your time because it forms your whole final restoration and makes your life a lot easier. Use it to establish contact, use it to establish your contour, and get good at it, because when you're done, you take that matrix off. You don't want to have a big glob of composite in there that you have to spend another 25 minutes filing down. So I think that's really important, and I think you'll benefit from it. On top of that, when you get to clinic, enjoy it. Best clinical experience out there. Take charge of your clinic and your schedule. I think a lot of students get to their clinic years and like to complain about not getting handed a good patient family or not getting lucky as other students with what they have or what they've been handed. Stay in clinic. You'll be surprised at what you stumble upon just by being around and being in acute care and being in oral surgery. You'll find some good cases just by being present and trying to help each other out. So stay engaged, don't rely on your PCC, take charge of your schedule and your clinic, and you'll turn out just fine. Enjoy the best year, the best 4 years. Graduating in May as a senior is super sad. I wish I could go back, so enjoy it while you're there.
Hey, new sophomores. Hope you're all ready to get started doing some of the actual dental part of dental school. Congrats on making it through your first year. It's a tough one, quick adjustment. My best advice for you as far as labs go is to practice the right way. That means not taking teeth out of your mannequin and trying your best to have good posture. It sounds silly, but you can't take teeth out of your patients downstairs to do work on them, and you'll kind of regret practicing only desktop dentistry when you've got an actual person in your chair. Try not to take any criticism you get too personally. Everyone just wants to make sure you're doing your best, and don't let Dr. Naughton get too much under your skin. Ask for advice, ask for help. Don't hesitate to ask multiple doctors what they think, and good luck. Enjoy your time, it goes quick.
Hey guys, I just wanted to stop in and first off say congratulations on finishing up your first year and making it to D2. I know last year was tough and this year will definitely be challenging. Just wanted to give you guys a couple words of advice, things I found helpful. First off, I'd say work with as many professors as you can while you're here at Creighton, whether it be in lab or in clinic. And just pick their brains about certain things that they're thinking or certain ways that they would do something. My second word of advice would be to know when to take a mental break from school or lab and get away with friends or family. My third word of advice would be to pay as much attention with Axiom as you can, whether it be in class or learning from third and fourth years. Just navigating the program will be very nice and helpful for next year. My fourth word of advice would be to spend as much time in clinic as you can and get experience before you get down there. The more things you can learn before you get down there will definitely make the transition easier. Hope you guys enjoy the rest of your year, and you're gonna do great.
Hey sophomores, this is Jed Keener in Bend, Oregon. I graduated in 2018 from Creighton Dental School. Just dropping in, give you a little advice for your sophomore year. My number one piece of advice was to just kind of be flexible with everything. Accept criticism that the professors have for you. And know that they've got your best interest at heart. I tried to view it as if they had advice or criticism for you, that means they care about you. They're not trying to kind of beat you down for the most part. So just kind of take it all in stride, trust the process, try not to get too stressed out with everything. And something that really helped me was to, I always try to just kind of leave, if you have a bad day at school, leave it at school. Go, get out of there for a little bit. For me, going to the golf course was kind of a nice little meditation time. Do whatever kind of gets you in a good mindset. Dental school is a long haul, and it's important to kind of keep that in mind. I don't stress out if you get a bad grade on something. I know that happened to me probably a decent amount. You can ask Dr. Radnicki about it. And just have fun with it. It's a great time. Learn as much as you can. Enjoy it. Creighton's a wonderful place to be. You guys are going to be more than prepared to go into clinic junior year, and going to be ready to kind of hit the workforce, and you'll be more prepared than any other dental school that you could go to. So good luck. Go Jace.
Creighton Dental School D2s. How you guys doing? My name is Andrew Geislinger. I had the great pleasure of graduating from the fine institution of Creighton Dental in 2020 during the pandemic. Terrible year, but what do you do? Dr. Radnicki contacted me to give you guys a little video about the importance of D2 year, and yeah, can't be understated. D2 year is probably the most important year of your educational experience at Creighton. You're going to learn every single thing that you need to do in the clinic, how to do it meticulously. That's one thing that's great about Creighton, is you're going to get a wide array of opinions, and different people showing you how to do things more than one way. You're going to get a great experience with all the different specialties, and when it comes down to it, come out of there as a great general dentist. So soak it up, listen to every single professor. They've all seen things and done things that you haven't done, so they're telling you something specifically for a reason. So when you're down in the trenches and it seems like you're doing stuff that shouldn't matter, at some point it will matter, I guarantee you. And in my first year out of school, I've had countless times where I'm like, oh wow, I remember doing that in D2 lab, and I have to do it on this tooth to restore it at this point. So listen to everyone there. It's great faculty, great people, and you'll all be successful dentists. So grind through that D2 year, and good luck the rest of the way. Thanks. I almost forgot the Dr. Radnicki line. Go Jays, baby.
Hey D2s, my piece of advice would be to definitely utilize all the different faculty you have available to you. Each of them will give you a different and unique perspective, which will help you in clinic and tackling a variety of cases. I would say definitely assist as much as possible. Go to One World. That'll show you how clinic runs and familiarize yourself with that. If you can, go to the Dominican Republic. You might learn about the number 2 molt from Dr. Rad, but all in all, it's a good time. So just know you got this. Good luck.
My piece of advice would be to familiarize and experiment with the different tools that are available to you at Creighton. For example, you'll have access to the automatrix and sectional matrices like the Garrison and Paladin, which is very important for getting predictable class tooth contact. So I'd get good at that for boards, but when you're an associate at a private practice, a lot of times you don't get a say in the materials that are available to you. So many practices will only have the Toffel-Meyer and HO bands for class 2s. So I'd also spend time getting proficient at using the most basic setups.
Hello sophomores, congratulations on making it this far. That's really exciting. Sophomore year is a big year, so I hope you have fun and you learn a lot. My name is Bri. I graduated in 2019. I wore this shirt especially for this video and to let all the professors know I still know what this means. Anyways, Dr. Radnicki had asked a few of us to think back on our sophomore year to come up with some advice for you guys. I figured run probably wasn't what they were looking for, so I came up with some other advice. Like I said, sophomore year, it's a really big year, but you need to learn the basics. That is what is going to carry you through the rest of your dental school career and your career after school. I just graduated from an AEGD here in Spokane, Washington. It was at a federal qualified health center. This is a place where ideal does not exist. So I had to make sure that I knew the basics to hopefully get the same result as if it were an ideal preparation, ideal restoration. So my next piece of advice, learn everything you can from each and every professor. They're there to help you learn. They all have their own techniques that are going to get you to the same concept, the same result. But you never know what situation you're going to be in when the technique you're using is not working and you have to try something else. Congratulations again, you guys. Creighton is a great school to be graduated from, to be an alumni of. You're going to be overly competent when you come out. So learn everything you can. Enjoy your experience there. It's stressful for sure, but it is one of the most rewarding experiences that you will ever go through. I hope all the professors are doing great. I miss you guys, and good luck.
Hi, my name is Elise. I just graduated. And some advice for you guys. I think the biggest thing I wish I would have done is kind of keep a notebook of all the random times doctors say random things about how to do procedures, like, sealing a proximal box with flowable, or, anything like that. The biggest thing about dentistry is when you get out, it's very much about how you want to do things and what you think is right. You no longer have to do things the Cavill way. You no longer have to do things the Rad way. So it's very much on you the next 3 years to learn how you want to practice, and just having the confidence to go out there and do it is a big thing too. So good luck to all of you. I know you'll do great. It's an extremely fun and frustrating 3 years, but it's kind of the best job in the world. So good luck, study hard, and you'll do great.
Alrighty, what's up, Blue Jay Nation? Welcome to Sophomore Operative Laboratory. My name is George Noyson. I'm a recent graduate of the class of 2021 from Creighton Dental School. I was asked by Dr. Radnicki to contribute a little bit to this video of little insight and recommendations and anything that I had to give you guys advice for this next upcoming year. I know sophomore year for sure for me was probably the toughest year of dental school. It feels like some things never end. You're kind of in the knit grit of everything in the battlefield, just down in the trenches. You're always getting stepped on mud. And it seems like you're never going to be able to crawl out. Well, I'm going to promise you that there is light at the end of the tunnel, and you're going to be a lot more appreciative after everything is done. So just hang in there, which brings me to my first point. I've got a little list here just to keep track of everything. So number one is trust the process. I know it sounds super cheesy, but just trust everything that you do. Believe in yourself, believe in your classmates, help each other. Don't be so critical of each other. I know we're all type A personalities. We all want to do well, but just take it as a learning experience. Everyone's there to help you, and especially with this lab, you're going to learn a lot in the next year. So just be kind of accepting to the willing of the fact that, you're going to be good on some things and you're not going to be, and you're going to be great at other things. So that brings me to number two is be ready to learn and be humbled. The biggest thing when I was a TA with Operative Lab was noticing after lab practicals, everybody would come up and complain about their grade to the faculty. I can promise you that your grade's not going to change. Whatever you get, just take it with a grain of salt. Ask what you can do better on the next time, practice those preps, and then go from there. That's the only way you're going to improve. I know with the real world, like what I'm doing right now, I'm in a 1-year GPR or oral surgery residency in downtown Minneapolis at Hennepin County. You got to learn on the fly. And if you're not willing to learn on the fly, you're not going to succeed. So it applies with everything in life outside of dental school. You got to take constructive criticism and move on to the next phase and just be hungry to do better. Next point, respect the faculty and their time that they give. They're there till dinner every night, especially operative labs. Some days get really, really long. It's deceiving for everybody. It's exhausting for everybody, and you just got to get through the process with each other. Okay. And then that brings me to some points to some faculty clicks. If you're looking for the GV Black of Operative Lab, go to Dr. Naughton. He's got great insight, whether it's just to do the ideal prep, outline form, and finish. Another way to click with him is to talk about his golf game and how he's a snowbird and he just migrates to Arizona when he's frustrated with school. So give him a hard time about his golf game. If you're looking for a dental school mom, who is my dental school mom to this day, Dr. Haslin, if you want to clash with her, talk about the Great Lakes of Minnesota up here and some hot dishes, you're going to be in the clear with her. If you're looking for a guy to talk about 90s music, his dogs, the great series of the Mighty Ducks, and of course movie lines, your guy is Dr. Radnicki. I can guarantee you'll get a good laugh out of him every single time you try to bring up a movie line, as long as you can quote it along with him. And finally, if you're looking for that Lord and Savior to help you get through Operative Lab and you're having a really, really rough time, you will look to Dr. Markham. He is your Lord and Savior of Creighton Dental School, and everybody should know that. Finally, just a little piece of advice from me: enjoy the ride. There's days where I still wish I was in dental school. It's a great time. I know it's a frustrating time, and it seems like you're just ready to get out of there. I do miss my Blue Jay family. I miss the faculty. I miss everybody that makes that dream of being in dental school possible, and to get you through it. There's so many people to thank along the way, and that's my other biggest piece of advice: is be thankful to everybody. Enjoy it, and I wish you guys all the best. If you have any questions regarding oral surgery process or GPRs or advanced education or even life outside of dental school or even about Minnesota in general, Dr. Radnicki has my contact information, and you guys can reach out with any questions or concerns at all. And as always, go Jays.
Hi Creighton family, my name is Karen Willems and I was a graduate of the 2021 class. One piece of advice I have for you as you embark in this new school year is to try everything. Different materials, different isolation techniques, and make sure to listen to the professors when they give you a different or a little clinical pearl. Those things will go a long way, as you'll soon find out on the clinic floor. Nothing in dentistry is really ever ideal, and especially when you get out in private practice, those tips and tricks will carry you through some pretty difficult appointments. So try them all, find out what you like, find out what you don't like, and then use it until you can kind of like it. Because a lot of times in private practice, especially if you're not the owner of the practice, you don't get a ton of say in the materials you use. Good luck on the school year, and as a wise man once said, go Jays.
What's up, D2s? My name's Kevin Reardon, class of 2020, here with a few tips per Dr. Rad's request. And none of these are clinical. But number one, be a good class. Be awesome to each other. How close your class is going to be a huge portion of how enjoyable your dental school experience is overall. It's going to lower your anxiety. It's going to make class more enjoyable. It's going to make your life more enjoyable. It's going to make the weekends more enjoyable. The teachers are going to like you more. Everyone's going to notice that you guys are nice to each other and helping each other out, and that's just going to make you more likable and make you more successful in general. So share what you have. Don't hoard materials. Share your study guides. Help each other out. You're literally all going to graduate. You're all in this together. That's number one. Number two, another way to get your teachers to not hate you: don't complain about your grades. If you get on a card a negative or a 4- on your prep or a 3+ or whatever the numbers, what does that even mean? I don't know. I don't know what they mean. You probably don't. I know for sure the teachers don't. They just write a number at random depending how they're feeling that day. It doesn't matter. But the thing is, it's a dumb system probably. Sorry, Dr. Ed, but it doesn't matter because there's 100 cards or 50 cards or whatever, and there's 5 things each on them, and it's like 3% of your grade. It literally does not matter at all. So rather than complaining about it to get someone to hate you, just accept it. Dr. O'Meara, -3, thank you, sir. You take that back to your desk. You just do the next prep because it doesn't matter. So just move on. Last one. If you're really fast, if you're like really fast or slow or good or smart or whatever, keep it to yourself. No one cares. It's just so easy to not be hateable. So if you are on card 17 and the person next to you is on card 3, keep it to yourself. Just quick tip, just shut up about it. Pretty freaking easy. No one cares. It's not going to make you a better dentist. No one is going to give you or respect you more for that. So if you're one of those people that's like think they're really cool because you're rushing out of class with 20 minutes left to go in the class, like, oh, I already finished all my cards. No one cares. However, I will mail you if you are the first one done. The first one done with your cards. I will mail you this plaque. Congrats, that's so cool. No one cares, so just keep it to yourself. And also, last thing, tell your class president that you love and appreciate them, because they're probably doing a lot more work than you think they are, and they are underappreciated and could use a hug probably. So just give them a high five, and that's all I got.